And the Council of Governors, in collaboration with the Ministry of Health, has agreed to scrap the controversial Managed Equipment Services Health Scheme. The service will now be referred to as National Equipment Support to Counties, which will be undertaken by the national government. MES was started in 2015 by the Ministry of Health on behalf of the 47 devolved units to supply and equip 2 hospitals in every county with high-tech machines to manage chronic diseases like cancer and diabetes.
We have had a sensitization session with the governors and the Council of Governors, and we are in agreement that now we go and start the rollout of universal health coverage, which was the promise that His Excellency the President gave. So we are good to go from here, and the ministry is ready. We start rollout in annex. But I also want to thank the governors that finally we have now executed the IPS. And that moving forward, the noise that has been around on the medical managed equipment services, that has been put to an end. And as a ministry, we have been given the mandate by the governors to proceed and get into service level agreements that shall ensure that services are provided at the county facilities. Thank you very much.
The Council of Governors, together with its partners, convened a 2-day consultative meeting between the national government and the county governments to review the intergovernmental relations and engagements between 2 levels of government, with a critical focus on health and social protection sectors.
Today we've witnessed the death of MES, or the MES, and we have now a new scheme called NESC, which is the National Equipment Support to Counties by the national government, which we have varied history on how the MES was consumed, or rather consummated. We are now on a new level where our interest is the service to the people, as long as the national government is providing the equipments. And we are convinced beyond any reasonable doubts that we have done the right decision. That is why we have signed today, because we need the equipment irrespective of the model of engagement with the vendors. Because as counties, as we are consumers, the agreement between the national government and the vendors is something they have already put in place, and they are satisfied that it is a good relationship. Otherwise, they would not have had us to sign the agreements today.